Thank you, Grace. So again, I'm Danielle Lee, and I'm with the Nutrition Policy Institute. We are within Agriculture and Natural Resources at the University of California. And the principal investigator for this project is Dr. Lorene Ritchie. Dr. Ritchie is a cooperative extension nutrition specialist within UC-ANR, and she's also the director of our organization. So a little bit about NPI, for those of you that are unfamiliar. We envision a world in which healthy food, beverages, and opportunities for physical activity are accessible, affordable, equitable, and sustainable for everyone. We do this by conducting and translating policy relevant research. And so I'm going to talk a little bit today about how we are incorporating stress and evaluation of stress in some of our research. So the project I'm going to be focusing on today is focusing on family childcare homes. And before I dive into that, this is a collaborative project. We are working with cooperative extension specialist Susanna Matias at UC Berkeley, the CACFP Roundtable, which is our advocacy partners, the California Department of Social Services, who license childcare providers and also administer the Child and Adult Care Food Program in California. And we also have a pretty robust advisory board as well. So for those of you who don't know, family childcare homes, these are unique compared to childcare centers. Family childcare home providers are often run by women in their homes, and they are primarily used by working families, families with young children, families that have alternative or non-traditional work hours, families with low income, and families, people of color as well. So in California, about just over a quarter of children in childcare are in family childcare homes. So just to give you a quick peek at the demographics of our family childcare home providers, this is from our colleagues in California at the Berkeley Center for Childcare Employment. They pulled together these statistics. So just to give you a little bit of context of who we're talking about. So most of these providers are women. They're married. Most of them are people of color. They work more than 40 hours a week. They're often more than 50 years old. It's an aging workforce. Most of them have children of their own as well. They speak languages other than English, and nearly half of them earn most or all of their household's income. And about 42% were born outside of the United States. So family childcare home providers have one of the lowest paying jobs in the nation. 98% of other jobs across the nation make more money than them. And so the annual income in California for small, caring for 6 to 8 children, and large, 12 to 14 children, can range from between $16,000 annually upwards to $56,000 annually. Now, these are the women that are in charge of caring for our children and also feeding our children too. So that's where the Child and Adult Care Food Program comes in. So for those of you who are unfamiliar, the Child and Adult Care Food Program, this is CACFP. This is equivalent to the school meal program, but for childcare. It is administered by the USDA, and it reaches over 4 million children across the nation. So childcare providers, through this program, they receive nutrition education on how and when and how to feed children, young children, and they also get money. They get reimbursements for serving up to 2 meals and 1 snack per day. And this could be breakfast, lunch, supper, dinner, and multiple snacks. These meals and snacks must meet nutrition standards. These are in alignment with the Dietary Guidelines for Americans, and our studies have shown that the food served in childcare for those participating in CACFP are more nutritious than foods served in childcare not participating in CACFP, and also foods provided from home. So family childcare home providers in CACFP can receive 2 different reimbursement rates. These rates are based on if they are low income themselves or if they serve a community that is low income. They receive the higher reimbursement rate. Okay, so that's tier 1. We're going to talk a little bit about those differences. So in California, this is data from California, and also nationally, what we are seeing is a decrease in the number of family childcare home providers across the nation. And in addition to that, decreased participation in CACFP. What's not reflected here, but is reflected nationally, there was a sharp decline in childcare providers and childcare employees across the nation in general due to COVID. This was largely due to most of us being home and not needing childcare. And their numbers are slowly increasing, but they're still facing persistent challenges as well. So the policy relevance. So during COVID-19, this definitely exacerbated declining access to the Child and Adult Care Food Program. Reimbursements from CACFP dropped by 21% by family child care home providers. And so that's where policy steps in. So Dr. Lung mentioned quite a bit about some of the policies that went into place during the pandemic. So with the Families First Coronavirus Response Act, what happened is the USDA actually eliminated those tiers, and all family child care home providers received the same higher reimbursement rate. In addition to that, that elimination of tiers was extended, and providers got an extra 10 cents per meal for reimbursement. So this is what that looks like. So you can see here these tables before the pandemic, the breakdown between Tier 1 and Tier 2 providers. During the pandemic, they all received $5.67. And these numbers here reflect claiming reimbursements for breakfast, lunch, and one snack, and this is per child per day. So the tiers ended and the waivers ended in June of this year. And so as you can see, Tier 1 providers are about the same as what they were getting during the pandemic, but Tier 2 providers had over a 50% reduction in their reimbursement rate. So our main aims, we have 3 distinct aims. I'm going to be focusing on aim 2 today, and we're really trying to understand what is this impact on tiering on these family child care home providers. And we're doing that through a mixed methods approach. So we are conducting surveys, and we're also conducting qualitative interviews. And the interviews we're conducting are not just with the providers, but they're also with the sponsors that they work with. Sponsors are the organizations that help them participate in CACFP, and also family recipients of CACFP. So stress actually wasn't one of our primary aims that we wanted to include in this study. We were actually approached from researchers from the University of Delaware and UCLA that work on family child care home providers as a employee population and also focus on nutrition. They actually asked us if we could add in questions around stress. So I did a quick lit review just to see what the studies have been showing around stress in this population. About 2/3 of family child care home providers have high levels of stress. And this is correlated with a lot of negative outcomes, particularly for their level of care that they're providing for the children and also for their intention to stay in the profession. So this is likely driving the decrease in the family child care home providers that we're seeing across the nation. So we chose to add in Cohen's perceived stress scale. And so those of you who don't know, there's 4 questions, and they can answer based on for a Likert scale. And this is scored up. 0 to 16 is the score, and the higher the score, that's correlated with the higher stress levels. So I'm going to share some preliminary results from our study. These are still preliminary because we are still working on entering data from our paper surveys. We had about 14% of surveys completed in Spanish. Most of our providers were women. We had a diverse population of providers as well. About 22% were food insecure. 6% said they had the intention of closing their business in the next year. And they had an average score of 4.2 for perceived stress. In addition to that, a majority of them had at or below $5,000 for their monthly income. So most of them provided full day care. There were about a quarter of them that provided care over the weekends as well. And they had a pretty diverse population of children that they cared for. In addition to them, they usually had 1 other staff member. So that average staff is 2. 1 and then 1 themselves and another, and most of the children they cared for were between 1 and 5 years. 77% of the providers said that the families that they serve do not have enough food at home, which shows the critical importance of providing food in childcare. So in some of our interviews, providers are telling us that, again, CACFP and the meals that they provide is very critical. Families in my care don't have to provide meals for their kids when they are here. And so being on the food program saves them money on at least 3 meals a day for their kids. So what we found, and again, these are preliminary results, we haven't done any adjusted analyses, but our studies are showing that there's likely a difference in the stress levels of Tier 1. Tier 1 are the ones that receive the higher reimbursement rate compared to Tier 2 providers. Tier 2 providers receive the lower reimbursement rate. So we're interested in exploring this a little bit more. And I do want to share some of the other results that do have some policy relevance as well. So we did ask providers their perception of the impact of the increased reimbursement rate that they received during the pandemic on the variety, and this is the number of different types, and also the quality, and this is like fresh and unprocessed. And they did say that the higher reimbursement rate resulted in more variety and better quality foods pretty much across the board and predominantly for fruits and vegetables. Most providers in CACFP don't think that the CACFP reimbursements are enough. And this was before they received the higher reimbursement rates. When they started getting the higher reimbursement rates, that shifted. So when they had the higher level of reimbursement, more of them thought it was a better amount. We were also curious, what amount would they actually need? What did they think would be adequate for them to provide meals and snacks to the children in their care? And as you can see, a majority of them needed between $6 to $8 per child per day. And this is for serving 2 meals and 1 snack. And you can see how that compares to the rates that they received during the pandemic and the current rates right now. We also asked providers what they anticipated would happen when the higher reimbursement levels came to an end. A lot of them anticipated that the variety of foods would decrease and what they charge for childcare would increase as well. They also thought the meals and snacks would be less appealing to children, and the healthiness of the snacks and meals would decrease, as well as the quality and the number. Fewer of them said they would leave CACFP and have providers or caregivers give the meals and snacks to the children instead of them, or they would leave and continue to offer. And very few of them said that they were going to close their childcare business. So a lot of them in our interviews are sharing that the rising cost of food, gas, and other goods and services due to inflation is having a significant impact. So even with that higher reimbursement rate that they received during the pandemic, that was almost just enough to kind of keep things at normal, like keep them going with what they were providing for meals and snacks. And with the end of the higher reimbursement rate, they're really worried. I would spend like $400 a week on groceries, and now it's like $600 a week. Financially, I'm not making this much, so I'm looking at needing to raise my rates. So that brings me to the policy implications. So Congressman Landsman and Bonamici from Oregon and Ohio introduced a bill recently. This is a marker bill for the Farm Bill. And this is to propose changes to CACFP reimbursement. So we're really excited about this. Ultimately, what this bill would do, it would eliminate tiered reimbursements, provide an additional 10-cent reimbursement rate tied to inflation, which is really important, and also allow these providers to get reimbursed for serving meals and snacks to their own kids while they're caring for other children. So just a quick summary. These are, again, our preliminary findings. And we are finding that, of course, family childcare homes play a pivotal role in providing food and secure families and children. The increased COVID-19 reimbursement rates positively affected providers' finances and also the food quality. The higher reimbursement improved variety and quality of fruits, vegetables, and other foods. And also the return of tiers may impact food diversity and meal snack quality and quantity, and also result in increased childcare fees to those families. And finally, the stress levels. We did see there might be some differences between those two tier providers, and we're interested in exploring that more. And of course, inflation continues to affect food, labor, and childcare costs. Our providers are advocating for elimination of tiers. They see it as unfair, and they would like increased CACFP rates. So this research was funded by the Healthy Eating Research Program. This is a program of the Robert Wood Johnson Foundation. We also received funding from UCSF. This is the California Collaborative Pandemic Recovery and Readiness, which is funded by the California Department of Public Health. And we also received a little bit of funding from the Department of Social Services to create a story map of some of our findings. And a thank you to our team. And then finally, we do have a really brief research brief. We put this out when that marker bill was released, just to kind of share a little bit of our preliminary findings. So that's it.
All right, thank you. We have time for one question while New Mexico is making their way up and get their slides set up. Do we have one question? Am I seeing a hand up back there? Did I? No, here we go. Sorry.
Can I assume that the reason why providers dropped out of the program when the rates went down was just that the burden of tracking and monitoring was just not worth the reimbursement rate?
That is absolutely coming up in our qualitative interviews and is also showing up in our quantitative survey data. So yes, that is a big part of it. A lot of them don't think that the reimbursement is enough to really motivate them to do all that tracking and reporting. And for these family childcare home providers, they're often required to do that daily. And that's a lot of work.